Hello, I'm Dr. Dhanya Dharmapalan. I'm a consultant in Paediatric infectious diseases at Apollo Hospitals, Navi, Mumbai. Now, with the onset of monsoon, there is respite from heat. But unfortunately, monsoon also brings along various monsoon-related illnesses which manifest as fever, cough, cold, vomiting, loose motions. Now let us begin with the respiratory illnesses. Because of increased humidity, there are various viruses which circulate easily, such as seasonal flu, like influenza, and even COVID is a bit on the rise. So what you should be doing in such a situation when the child suffers from fever, cold and cough? Importantly, control fever with the use of paracetamol. It is the safest fever medicine and it can be given at 4 to 6 hours interval whenever temperature is 100 degrees or more. For blocked nose, you can put saline nose drops. The doctor may prescribe you cough syrup. In case the child is wheezing, the cough syrup may contain bronchodilators such as salbutamol. And on basis of the severity of wheezing, the child may receive some nebulizations also. Now, importantly, most of these viral flu illnesses such as influenza can be prevented with vaccines. So, influenza vaccine is a safe and very effective vaccine which is offered from 6 months of age onwards, and any age can take this vaccine. So this vaccine is an annual vaccine which is best taken before the onset of monsoon. COVID vaccine should be given to those who are age eligible as per our national program. That also is a very important vaccine. Now coming to the waterborne illnesses such as acute gastroenteritis, these outbreaks increase because of water contamination due to the rains. So please use boiled water and eat hygienic food. Cover the food to protect against flies. Now in case your child is vomiting and having loose motions, most important is to maintain hydration in your child. So give oral rehydration solution. ORS packets are available in all medical stores and it is reconstituted by adding the packet to 1 liter of boiled and cooled water. Also, ready to drink ORS sachets are available also in different flavors as per your child's choice. The alternatives to ORS are homemade ORS, that is you put a pinch of salt and a bit of sugar, muthi bhar sugar, say in a glass of water. So the other alternatives are lemon juice, coconut water, buttermilk, rice kanji. But please remember, ORS is usually salt sugar solution. Therefore, carbonated drinks, beverages as well as sweetened fruit juices are not ORS and should not be offered when the child has loose motions. Now coming to the other waterborne illnesses such as typhoid and hepatitis A. These outbreaks are also common during monsoon illnesses. So as I said, protect yourself by drinking boiled water and having hygienic food. Also, very good vaccines are available against these illnesses. So please check with your pediatrician if your child has been vaccinated against typhoid and hepatitis A. Now coming to mosquito-borne illnesses such as dengue, malaria, chikungunya. So water logging and water collection around the houses, they give a good breeding site for the mosquitoes. Therefore, you see these outbreaks during and post-monsoon monsoon. So what you need to protect yourselves from mosquito bites by mosquito repellent creams. You can use mosquito nets in the house. Avoid water collection like flower pots or open water tanks. And these dengue mosquitoes, they lay eggs in fresh water. Also, you can and can bite in the day, vis-a-vis the malarial mosquitoes which lay eggs in stagnant water. So that is why it's important to avoid water collection in and around the houses. Also, you can wear full sleeves and while before going out. Now, during dengue, it is most important the child passes urine well. The platelets which fall gradually rise on its own, but it is important that the child is well hydrated. In case the child is tested malaria then in the blood, then the doctor will prescribe anti-malarial accordingly. The other outbreak which you will hear during monsoon is leptospirosis. Usually it occurs after a flooding. So please avoid wading through flooded waters. Do not allow children to play in flooded waters because leptospira, they can penetrate broken skin, and antibiotics are needed if the child suffers from leptospira. But here I would like to highlight that most of the conditions I mentioned earlier, that is the viral respiratory infections or viral gastroenteritis, these are all caused by viruses which do not require antibiotics, because antibiotics do not work against viruses. All you need to do is treat as per the symptoms and let the child rest at home, give a lot of liquids, and the child usually recovers without any problem. Lastly, the skin infections are also common because of humidity. Children tend to sweat a lot, so if there is intense itching with redness, especially in the private areas or in the folds of the body, it could be a sign of a fungal infection. Make sure that your child, if the child sweats a lot, has a bath at least twice daily and keeps himself dry. And of course, if there is any such fungal infection, the doctors prescribe antifungal cream. I also need to tell you that even parasitic infections are common. So please wash the vegetables and fruits well, because they can get contaminated with eggs of worms. So please stay safe and healthy and enjoy the monsoon. Thank you.